Hi and welcome back all of you to the next series of short lectures on general medicine. Today I'm going to discuss with you another important area, which is antiphospholipid syndrome. Okay, and as you know, in short lectures we discuss a short topic which is not included in the long lectures. Long lectures means it's basically much more towards the systematic kind of lectures where detailed information is required, but short lectures means something where you have to understand like very uncommon topic, but question has come. Okay, so you have to understand the basics behind that, and maybe you can get one or two new questions in the coming years, so you have to understand it. Okay, basically when they ask these questions, initially the questions will be a very simple kind of thing, but as you go on the things get more and more complicated in the coming years, so you have to understand the basic of this. Okay, so antiphospholipid syndrome comes under a condition known as hypercoagulable states. Okay, so what is this hypercoagulable states? It means there is increased coagulation. Okay, in the blood vessel there is increased coagulation. This is like stated by the term called thrombophilia. Okay, thrombophilia means there is increased chance of coagulation within the blood vessels. Okay, now you have three conditions which is associated with hypercoagulable states. One is antiphospholipid syndrome, which we could discuss now, and there is something known as HUS, hemolytic uremic syndrome, and Budd-Chiari syndrome. So the second two I'm not going to discuss along with here, because it will become a very long lecture. I'll discuss that in a separate lecture, but here I'm going to discuss about antiphospholipid syndrome, where questions has come. Okay, so let us start antiphospholipid syndrome. Basically, what is antiphospholipid syndrome? Here you have got so it's an autoimmune disease. There is an auto antibody, okay, and which is directed against phospholipids. So that's the name, antiphospholipid syndrome. Okay, now I'll discuss what is phospholipid, where phospholipid and all. So it's an auto antibody mediated acquired, so it's not congenital. Thrombophilia means it's a state where there is increased chance of coagulation. So it's different from, you have to differentiate it from thrombocytopenia and thrombocytopenia and thrombocytosis. Thrombocytopenia means decreased platelets, thrombocytosis means increased platelets, and here it is thrombophilia. Okay, thrombophilia. So do understand this term, thrombophilia. Okay, so now you have further, the definition goes on where there is antibody against the phospholipids and there is thus thrombophilia. So there will be recurrent arterial or venous thrombosis. So there is thrombosis in the arterial system or the venous system. Along with that, it is seen that there is some pregnancy related complications. So naturally it's understood that it's more common in females. Okay, so there is pregnancy morbidity associated. So hope you understood the term. So if this much, if you understand, you can answer the question which was asked for you, because it's basically an autoimmune antibody directed against the phospholipids. Okay, now let us see what are the antibodies directed against and what are the different types of important antibodies which you have to know. So now if you see a cell, I'll just draw a cell here. It has got a cell membrane, outside cell membrane is there. Now this cell membrane, as you know, it contains lipids and proteins, and the lipids are phospholipids. We have studied this details about phospholipids in biochemistry. Okay, so different types of phospholipids are there, which is detailed explained in the biochemistry. Now antibodies are directed against this phospholipids or those plasma proteins which bind to this phospholipid. So there are some outside plasma proteins comes and bind to this phospholipids. So the antibodies are directed against this plasma proteins as well. Now there are three very important antibodies which you have to know. Okay, so this is, one is anti-cardiolipin antibody, anti-beta 2 glycoprotein 1 antibody, so anti-beta 2 GP1, okay, and lupus anticoagulant antibody. Now one thing you have to understand, whatever terms come, it's related to this, because why, phospholipids are there in any cell. Okay, it's outer covering of any cell, whether it's cardiac cell or any other cell. There is what you call it as, there is phospholipids. So any cell can be destroyed by these antibodies. Okay, so three very important antibodies are anti-cardiolipin antibodies, anti-beta 2 GP1. Now this anti-beta 2 glycoprotein 1 is basically this one. Okay, I told you, you have got certain cells, or all the cells which has got phospholipids, and on that phospholipid certain plasma proteins come and bind. So this is one of such plasma protein, that is anti-beta 2 glycoprotein 1, and naturally there is lupus anticoagulant which is associated with this. Now these are three very important antibodies which you have to know. One more thing, just an extra point, this lupus anticoagulant can lead to an increase or prolonged APTT. Okay, APTT, you know this, we have discussed about the coagulation time, all those lab investigations related to the coagulation we have already discussed. So you know what is APTT, lectures are there. So this thing can increase APTT. Okay, so in a lab finding you can see increased APTT due to this lupus anticoagulant. And they also say that there is antibodies against Treponema pallidum phospholipid. Again, it also has got phospholipid. So antibodies are directed against this phospholipid also. So what is the problem you can get if such things happen? The thing is that you can get a false positive VDRL test. Okay, false positive VDRL test for syphilis. Okay, because Treponema pallidum causes syphilis. So you can get a false positive VDRL test in these patients with antiphospholipid syndrome. So remember, these are the antibodies. Okay, which are the antibodies? The first one is anti-cardiolipin, anti-beta 2 GP1, lupus anticoagulant. Okay, lupus anticoagulant increases APTT, and then you have the anticoagulant or antibodies against Treponema pallidum phospholipid, which can result in a false positive VDRL test. Now, just to understand, okay, pathogenesis, I don't think questions will come, but just to understand what is happening and why is this thrombosis happening here, why antibodies are producing thrombosis. Okay, we know there are different agents which can produce thrombosis, platelets and all those, but why is antibodies producing thrombosis? Let us see. So here what happens, either infections or any kind of oxidative stress or any physical stress like surgery or trauma, what happens is it leads to these three things, or anything else, any kind of stress can lead to apoptosis of the endothelial cells. Okay, you know, you have got the blood vessels has got what is known as endothelial cells. So this endothelial cells are apoptosized due to these reasons. Okay, not antibody, due to the infections or kind of thing. And as a result, you know, endothelial cells are also cells. So they also contain what? Phospholipids. So now this phospholipid is exposed. Okay, this causes exposure of phospholipids. Now what happens here is, with this phospholipid there is binding of some serum proteins. Okay, there is proteins in the serum, you know, and one of such protein is, we've already discussed, beta 2 GPI. Okay, we have discussed one here, isn't it? Beta 2 GPI. So antibodies are directed against it. Okay, so this binding, okay, binding of not just this one, any other plasma protein also can lead to production of a new antigen here. Okay, so phospholipids are exposed. Okay, and to this phospholipids which is exposed, this particular protein binds and you get a new antigen kind of thing. Okay, now against this antigen you get antibodies. This is what happens. Okay, now still thrombosis has not taken place. Let's see how thrombosis takes place. Now this antibodies are binding to the endothelial cells. So you have this endothelial cells which are disrupted. So I'll just draw it like this. Okay, so there is the disrupted endothelial cells, and antibodies come and bind to this disrupted endothelial cells. Okay, and when they bind to this disrupted endothelial cells in platelet disorders, or platelet coagulation, the platelet plug formation and all, you have learned that it comes and binds with the, or binding of this antibodies with the disrupted endothelial cells and the subendothelial collagen can initiate the coagulation process. Okay, this can initiate the coagulation process and just leading to intravascular coagulation and thrombus formation. So if you have to understand this, forget it. You are not going to get any question, just wanted to explain how things are happening here, that's all. Okay, so how this antibody, why this antibodies are produced and what does it do? It binds with the endothelial cells and initiates the coagulation process. Much more important is the clinical features. Now let us come on to the clinical features, and in the section of clinical features you can have either the problem associated with thrombosis, I told you, or something associated with pregnancy morbidity or complications associated with pregnancy. Now this pregnancy morbidity is important in diagnosis, so I'll just give you some points which are very important. What happens here? Either it can lead to premature birth of the baby, okay, premature birth, or in some cases spontaneous abortions can take place, okay, spontaneous abortions of the baby, or even unexplained death of the baby. So these are very common features you can see, okay, and this is a very important in diagnosis. Okay, I'll tell you about this. Now coming on to the vascular thrombosis part, the thrombosis can either occur in the venous system or arterial system. And please understand that the thrombosis in the venous system is much more common, okay, more common, and you have some very important features which is associated here. One is DVT, deep vein thrombosis. We have studied this in general surgery, isn't it? Deep vein thrombosis. Then there can be pulmonary embolism. If there is a pulmonary vein is being blocked, it can lead to pulmonary embolism. So where it is blocked, depending on that, it will cause problems. So if the pulmonary vein is blocked, it can lead to pulmonary embolism. Now if the vessels of the skin are, or the veins of the skin are blocked, you get a cutaneous lesion known as Livoido Reticularis. Okay, Livoido Reticularis. So this you can Google it out. It's a skin lesion, it's a purplish lesion of the skin. Just know the name here. Okay, what are the lesions associated with veins? It is DVT, pulmonary embolism, and Livoido Reticularis. Three very important lesions, which if there is a venous block, okay, so if there is a venous block of the leg, okay, extremities, it can lead to DVT. If it's pulmonary vein, it's pulmonary embolism and Livoido Reticularis. So that's about the venous thrombosis. Now let us come on to the arterial thrombosis. The arteries of the CNS, central nervous system, heart or lungs can be affected, and even kidney or any organ can be affected, but importantly I'm just discussing about these three. If the artery of the CNS is being blocked or thrombosed, you can get stroke. If heart, understandable, it can lead to myocardial infarction. Lungs, again, pulmonary, okay, embolism. Okay, pulmonary embolism can result. So these are the symptoms or clinical features associated. What we studied was, one is it can be either associated with vascular thrombosis or pregnancy complications. Pregnancy is premature birth, spontaneous abortions, or even death. Then the thrombosis related things, it can be either venous thrombosis or arterial. Venous is more common, and it's what you can see here is DVT, pulmonary embolism, and Livoido Reticularis. Arterial, it can be affecting the CNS, resulting in stroke, or heart, resulting in MI, or lungs, pulmonary embolism, whatever, okay, whichever organ it can result. Now next is about some other very important features. Lots of features are there, but I'm just discussing the most important one. One is thrombocytopenia. So what all we can have here? We can have in this condition, Antiphospholipid syndrome. One is it can result in thrombosis. Second, it can result in pregnancy complication. Third is thrombocytopenia, that is decreased platelets. So now we understand the two terms. What was that? When I started the discussion, I said this is a condition where there is thrombophilia. So thrombophilia means something which is associated with coagulation, and thrombocytopenia means decreased platelets, okay, decreased platelets. So this decreased platelets, usually if there is decreased platelets, what can happen is bleeding can occur, but remember there is no severe bleeding here, So why am I saying this? Because in some questions you can get option severe bleeding. So remember, there is thrombocytopenia, but there is no severe bleeding. One, okay, decreased platelet but no severe bleeding. Second thing is, in the option they can give you thrombocytosis. So remember, it's not thrombocytosis, it is not increased platelet, it is decreased platelets. Another thing, so why this thrombocytopenia? Again, platelets has got a membrane, platelets has got phospholipid on the membrane, antibodies can attack these platelets, killing the platelets. Again, RBCs can be attacked, which can lead to hemolytic anemia, and this are being attacked by antibodies, so it's Coombs positive. So any autoantibody related anemia is Coombs positive hemolytic anemia. This we'll study in detail when it comes to microbiology. Okay, so these are the two additional features, thrombocytopenia and hemolytic anemias. So four things you have to remember here. One is thrombosis, pregnancy complications, thrombocytopenia and hemolytic anemia. Okay, now when you come on to the diagnosis part, okay, the diagnosis part is confirmed by two things. If there is one clinical criteria and one lab criteria, that is, it means that if there is only clinical, you can't confirm the diagnosis. There is only lab criteria, you can't confirm. There should be one clinical and one lab criteria to confirm the diagnosis. So what are the clinical criteria? We already studied them, isn't it? What are the clinical criteria? It is, one is thrombosis, isn't it? Anything which is associated with thrombosis has to be seen, some symptoms associated with thrombosis. Now anything which is associated with pregnancy, morbidity, okay, abortion, death, so these three things, okay, these three things are primarily to be considered. Okay, they will give you lots of options. So premature birth, spontaneous abortions and death. So any of these three, so either of these two, one of these two is there, plus one lab criteria. So what was the lab criteria? Lab criteria was nothing but these three antibodies. Okay, the three antibodies we studied: anti-cardiolipins, anti-beta-2-GP1 and lupus anticoagulant. So any of these three antibody, okay, any of these three antibodies which is seen, but now there is a condition. Any of these three antibodies are present for two or more occasions, at least 12 weeks apart. 12 weeks apart. So this is one condition. This antibody is not just once, it should be there for two occasions, and they should be 12 weeks apart. Okay, at least 12 weeks apart. So what does it mean? If you have thrombosis, if you have pregnancy, either one, plus if you have any of the three antibodies present for this much duration, then it is Anti-Phospholipid Syndrome. Okay, now finally you come on to the treatment part where anticoagulants are used. Warfarin, aspirin, low molecular weight, heparin, all those things can be used. One thing keep in mind, again you can get an option, glucocorticoids are not effective. Okay, glucocorticoids are not effective, remember. Okay, glucocorticoids are not effective. So that's it for this part. A quick review of antiphospholipid syndrome. We studied there are three: antiphospholipid, hemolytic uremic and Bucchiari. Okay, then antiphospholipid means it's simple, antibodies against the phospholipids, which is a kind of acquired thrombophilia. Okay, where you can get arterial and venous thrombosis with pregnancy morbidity. This much you have to know. What are the antibodies? Antibodies are simple: anti-cardiolipin antibodies, anti-beta-2-GP1 antibodies and lupus anticoagulant, which increases the APTT. Then there is antibodies against Treponema pallidum. So it can result in false positive VDRL. Pathogenesis, nothing is required. If you don't understand, forget it. There is intravascular coagulation and thrombosis. Okay, now antibodies directed against phospholipid and there is thrombosis. Now coming on to more important clinical features, that is there is vascular thrombosis, there is pregnancy morbidity. Three very important, lots of features are there. So three very important which is there important for the diagnosis. So remember this, only these three criteria are included in the diagnosis. Any other pregnancy complication is not considered. There is hypertension, nothing. Okay, these three are important. So premature birth, spontaneous abortions, and death, spontaneous unexplained death. So thrombosis, it can be either venous thrombosis or arterial thrombosis. Venous thrombosis, very important, it can be DVT, okay, it can be pulmonary embolism, livoido reticularis. Okay, remember livoido reticularis is also seen in some other conditions as well. It's not very pathognomonic, but still just know it. Now you have arterial thrombosis resulting in CNS stroke, MI, or pulmonary edema. Now other very important two features are thrombocytopenia, okay, not cytosis, which does not lead to severe bleeding, and hemolytic anemia, which is Coombs positive. Diagnosis is confirmed by, it should be one clinical criteria plus one lab criteria, okay, and the clinical criteria are either thrombosis associated things or pregnancy associated, three things which we explained, okay. Then lab criteria, any of the three antibodies which is there for two or more occasions which are there for 12 weeks apart. Treatment part is the warfarin, aspirin, but no glucocorticoids. Okay, so that's it for this short lecture. Hope you have understood about antiphospholipid syndrome. You can easily answer any question based on this now. Okay, so that's it.